I'm receiving that life force energy as I'm giving it. And so the more I give, the better I feel, which is was so revolutionary.
Welcome to the Learn Skin podcast with me, Dr. Raja.
And me, Dr. Hadar, where we discuss all things skin.
Join us as we delve into the art and science of skin health in today's episode.
Hey, Raja, can you say the thing I told you to tell them?
Of course. We are board-certified dermatologists. This podcast is meant for educational and informational purposes only and is not considered medical advice, nor does it serve as a substitute for professional care by a doctor or other qualified medical professional. All opinions shared do not express the views of Learn Health, Inc. Let's get to the good stuff.
Hey, Raja, how are you today?
Hey, Hadar, doing pretty well. You know, I've just been thinking a lot about energy recently.
Yes. You know, what I think about is there are so many different practices out there that we could leverage totally in the clinic, and just being aware of what our patients are doing will make us a better holistic doctor. You know, we think of various practices, we say, oh, this is not going to heal psoriasis. It doesn't need to. There's so much out there. And I thought, can we at least visit one practice of those many that are out there?
Yeah, absolutely. And in fact, when we think about energy-based medicines, one of the ones that has really taken hold, I think, is Reiki. And we're going to learn more about it. But we have an expert, Hadar, because I'm not going to learn Reiki from you. And
are you serious?
Sure, you're not going to learn from me, my friend. So we're going to have to go elsewhere for this. Our energies are just not up to speed. But luckily, we have Dr. Judith Hong, who's a board-certified dermatologist. She's out in private practice in Santa Rosa, California. And in fact, she does a lot of work in Reiki, and she's lectured for us multiple times. I'm thinking, what the heck took us so long to bring you on the podcast, Judith? But welcome.
Yeah, thanks so much for having me. It's been really great to be part of the integrative, dermatology and Learn Skin, and it's really helped grow my passion in Reiki with such a supportive environment. Thank you.
Absolutely. Judith, Raja is absolutely correct. In my mind, we've done this podcast and we looked through the episode. I can't believe we didn't have Judith yet. And I'm so happy you're here. I definitely need to rework my energy priorities and understand, how did I not know this? I really want to hear your story, how you got to Reiki, of all the different practices, and what is in it that attracts you to it. But for our audiences who may have only heard the term before, can you give us a one sentence kind of idea of what Reiki is, and then tell us what made you choose that as such a significant part of your life?
Yeah, so Reiki is a Japanese origin form of energy healing. And I do like to start with the National Center for Complementary and Integrative Health definition, which is Reiki is a complementary health approach in which practitioners place their hands lightly on or just above a person with the goal of directing energy to help facilitate the person's own healing response. It's based on an Eastern belief in an energy that supports the body's innate or natural healing ability. So that's the official definition you'll find if you look at the NCCIH website. And the way I like to describe it simply is that it's Reiki. So Rei's universal key is life energy. And so it's just a concept that there is life force energy all around us. Some people call it prana or chi. Those are just different terms. And there's this practice where we can connect and be a conduit for this energy that's all around us and allow it to flow through us, often through our hands, and usually with the intention of it to benefit a person, or even you could do it for animals, you can do it for situations, just to benefit them in, whatever way wants to come through. So that's the very kind of simple explanation. And in terms of how I got into it, it's a lot of synchronicity, which, happens in our life. And I finished residency at UCSF, and I went up to Sonoma County to join a private practice there. And one of the first friends I met, her name is Cheryl Janice, and she started to open me up about the concept of energy and intuition. And after we talked, she said, "Oh, you're an empath." And I was like, "What's that?" And then I kind of looked it up. I was like, "Oh, yeah, I guess I am an empath." And then it's funny, I just started to meet different people, different realms. One friend is actually a professional intuitive, and she just one day said, Judith, you should do Reiki. I was like, okay, I don't know what that is. And then I met someone else and they said, oh, you should really do Reiki. And I kept ignoring it. And actually, finally, it was a patient with their new patient paperwork, and under occupation, it said Reiki master. And so I did her visit. It was, tinea versicolor, so, pretty straightforward. And then at the end, I just said, hey, where did you learn this Reiki thing? And she said, I don't teach, but I recommend this, local teacher, Daily Little. And so I went on the website. There was a class the next week and I signed up for it. I didn't even really know what it was, but I'm a curious person. So I thought, well, why not try it? And when I did it, it was interesting because I really didn't feel anything. So other people were saying they were feeling energy and they're having the experiences. And I felt really calm. But when I was practicing over, someone of my hands there, the teacher commented, she said, wow, there's a lot of energy flowing through you and through your hands. And so, me, of course, we've been students our whole life and we like, praise for a good job done. And I was like, oh, wow, okay, there's energy flowing through me. And she recommended that you practice on a lot of people after you learn Reiki. So being a good student that I am, I followed directions and, I kind of studied the protocol and I started practicing. And that's where really the incredible magic started happening. And may I go ahead and share an anecdote about the first patient I ever did Reiki on?
Absolutely.
Okay. So this was just 2 months after I did my Reiki level 1 class. And it was this 45-year-old woman. She had severe anxiety. I diagnosed a melanoma in situ in her and she needed an excision. And I did, I pre-medicated her with 1 milligram Ativan. But during the visit, she was still having severe anxiety. And I tried to talk to her, just deep breathing exercises, visualizations, but she was almost having a full panic attack on the table. And, I'm like gloved up, about ready to do my excision. So I just burst out and said, hey, do you know what Reiki is? And she said, yeah, my cousin does Reiki. And I said, well, I just took this workshop. Could I just do a little Reiki on you? And she said, sure. And so I just hovered my hands, gloved up for, I think, about 30 seconds. And my medical assistant is standing across the way from me. And she transforms in front of the table, like in front of our eyes. And I'm looking bug-eyed at my medical assistant. And I like to read her Yelp review because these are her words and not mine. But it kind of captures what happened. So you can find this on Yelp. And she wrote, Dr. Hong is above and beyond any MD I've ever been treated by. First, she found, biopsied, and verified the melanoma on my back. Then when I arrived to have her remove it, I was a mess, totally anxious, scared, shaking, and crying. Dr. Hong is clearly much more than a great MD. She's a kind, caring, and amazing energy healer. When Dr. Hong put her hands on my back, near the site to be removed, my whole body stopped shaking. I became immediately calm. And as she was working on me, I became even more calm. I know it's because of her healing energy and presence. By the end of the surgery, I felt completely peaceful in my body. The whole experience was quite spiritual for me. Dr. Hong indeed gave me a healing on mind, body, and soul level.
Wow, that's amazing. Judith, I want to kind of break in here for a second because what you just read, obviously it's great to hear because, your patient did so well and obviously had a positive experience. And we all have patients who have positive experiences. What I think is really interesting here is doing practices such as Reiki and whatever you guys do in your practice, whoever is listening out there, taking that extra step allows you to treat the human being in front of you. And Judith, kudos to you for seeing what the patient needed and really going after it with your specific technique and your skill set. But everybody has a skill set and they can learn Reiki or other things. But the point here is that when you try to treat the whole person in front of you, there's a connection there. The patient recognizes it. And then when you go home as a clinician, you are a much better clinician for doing that. And I just want to highlight this because I've seen it numerous times, be it taking the extra mile with some complementary practice, specifically talking about nutrition, talking about exercise, talking about the patient's life in general, really trying to make that connection, I think really heals the patient beyond their skin, but also heals the provider. So thank you for sharing that. That was great.
Absolutely. And thanks for pointing that out. And that's what I feel like is so important. And I talk about Reiki is it's not the science of medicine, but it's the art of medicine. And we have so many ways of doing that. And we can bring in our own things that help us feel connected and help us bring that empathy and compassion practice to our patients. It's just Reiki for me happened to be this very simple, very easy practice that really worked for me. So I
Yeah.
like sharing that you never quite know what makes a positive impact in your life and other people's lives. And I cannot believe that, if you asked me 10 years ago that you would be talking about Reiki to other dermatologists for a podcast or teaching
Right.
Reiki to physicians, I would say, what
Well,
are you nuts? So it's just kind of fun to see what unfolds.
Right. There's other questions I want to ask you, but for those out there who are listening, Judith said something about the science and no science. I just want to point out there is a robust body of evidence that Reiki practice helps, at the very least, anxiety in various indications. And these are randomized controlled trials with reasonable numbers, some in the double digits, some in the triple digits. But what emerges to me is when I look at that literature altogether, is that there's something there. And Judith, like you said, you as a person receiving the treatment initially may have not felt it, but then as a practitioner of it, you did start feeling it. And so I think that regardless of if you tried it or not, just know that there's a robust body of evidence that if I looked at it for anything else, pharmaceutical or a procedure, I would say this seems like it's doing something. And like I think we learned, and we say this a lot, I think, but not enough, is that when we prescribe treatments, even though we have randomized controlled trials at this point, but even if there isn't, if the risk is so minimal, right, the side effects are non-existent virtually, then why not? And so I think this falls squarely into that category. All right. So Judith, I wanted to ask you, maybe now that we understand what it is, how you kind of got into it, you gave us a little bit of a sense with that little case that you shared, but how do you utilize Reiki in your work? And then maybe you can share a little bit about your personal life if you want to, but I think our listeners are really curious to hear, okay, there's a thing there, there's some evidence behind it, but how do I weave it into my practice?
I want to make a comment here. Actually, I do want to know how you use it in your personal life, because one of the things that I think is special about integrative approaches is, see, in medicine, we're really good about saying things that we don't do to ourselves a lot. And I feel like that's almost
Very true.
the meaning of medicine, is that we almost once in a while you struggle with something, or you have something that you use on yourself and you're like, oh, now I understand the patient perspective or whatever it is. But I feel like in integrative medicine, there are a lot of things that we take on, we learn, and then we apply them to ourselves and we become changed. And so I am curious, Judith, if you can speak to that too, in addition to how you use it in the clinic.
Great point, Raja. Agree 100%. I mean, most of us have never injected a biologic yet. We write it a lot, right? And so, and once you have to do one of those things, you kind of feel differently the next time you prescribe it. So I think it's an excellent point, Raja. Thank you.
Yeah, absolutely. So I'll address both how I use it in patients and how I use it for myself. And just to dovetail briefly on what you said, Hadar, about the evidence, there is a website called Center for Reiki Research that does summarize and have a listing of all the randomized placebo-controlled trials they use. So there are placebo-controlled. They actually have people doing sham Reiki. So it's, so that part is addressed. And then all the studies out there, none of them have shown any harm. So I can confidently tell people does no harm and it may help. So it won't hurt. And I love having something I can offer. I mean, how many things can we offer where you can, just say there's no harm and it's been studied, and that's just how Reiki works.
Can I just interject with the funny thing that the Cochrane review came out with? When they looked at isotretinoin for acne, they also said there was insufficient evidence that it was helpful for acne. But they did point out that there was harm with it. But the whole thing is just kind of ridiculous, right?
Yes.
When I get into these systematic reviews and Cochrane reviews, it's like proof that the one medication that probably got the most effectivity was deemed to be not effective.
Exactly. So taking the, quoting scientific studies with a grain of salt also. So yes, it's good to point that out, that we want to, be as rigorous as we can and learn the studies, but also just use our common sense and our judgment and our clinical experience with all our decision making. So in terms of how I use it with my patients, so I'm not in a integrative practice per se. I'm in a private practice. I practice very, traditional dermatology, but I have used it in select patients. And mostly it's when I notice it's a patient that's very sensitive and they're empaths and they're struggling with, the procedure. I use it a lot with my procedures, actually. So people that are scared of needles, scared of procedures, it's a very simple thing. I just give them a brief description of Reiki. I just say it's really intention for your well-being and helps calm you down. What's nice is you're in 30 seconds of silence and they know the patient, you're just there to support them and that you care about them. And I'll do Reiki, and I'd say it really, it really helps. I've actually had one patient, I'll tell this anecdote really quickly, who came back. She had severe needle phobia, was hyperventilating. I did Reiki, did the biopsy. She came back next time and she said, "Doctor, you cured me of my needle phobia." And she said, I like, it's not. And I was like, what? It was unbelievable. So she's like, yeah. She's like, I'm 56, been scared of needles my whole life. Totally fine. Went to the dentist and I had to do another biopsy. She's like, look, I'm totally fine. And
Judith, you didn't share that part of the story. My gosh, that's actually pretty big. We need to get all the tattooed guys coming in, passing out on biopsy.
I know. Oh, it's so funny. I've just had these funny stories and I just shrug my shoulders. I just say, it's not really me. You opened up to the life force energy and healing. So that's, you really are the one that's healing yourself, and that's the concept of Reiki, is like, I'm not doing anything. I'm actually staying out of the way and being a conduit for them to just connect to their own body's healing ability and the life force energy about it, which is what I love. I do it on my staff periodically. I've done it on my colleagues. So if I see someone coming in, they have something happen, they're having a really bad day, I'll pull them into my office, sit them down 30 seconds, put my hands on them, and it really helps, And so I just found it to be this really great tool to support people without having to say anything, without trying to fix them, and just being present with them. And so that dovetails into my personal life. So it's completely transformed my personal life and my self-care practice and my own well-being. And it's really helped me just relax and calm down more, because what I learned, I could never meditate, but I learned Reiki, and being someone that always likes to offer something to someone else, it's easy for me to offer Reiki, but as I do Reiki, I'm actually in a meditative state and I'm in a calm state. And the concept is that I'm receiving that life force energy as I'm giving it. And so the more I give, the better I feel, which is just was so revolutionary for me, because I think, we often live in a world where it's, you give and you do and you force and you give of yourself, give of your own life force energy to, help others. And this is why it blew my mind. And I love Reiki, because I'm like, okay, you're saying I get to do nothing and I get to feel better and the other person gets to feel better. Sign me up. So I do self Reiki. I Reiki when I go into the office and I enter. It's a mindfulness technique. So I'll look at my schedule and I'll just send Reiki for all my patients. And in the sense, it's very generalized. I'm not sending a treatment, but it's just the intention that I can be, of the most sound mind, body, and spirit, and be able to help my patients in the best way possible. And also, supporting my office and staff, and just setting the whole energy, as the physicians, we really do set the tone for our staff, for our patients, for everything. And this has been a way for me to really manage my own wellness, my own well-being, how I show up. If I'm frazzled and I'm, stressed out and angry, that's going to impact everyone else. So I do it on myself first, beyond anything else. And I always kind of just working energetically with myself. And then that itself is transformative for, how I show up, as a wife, a doctor, a dog parent, all these different aspects. So it's been life-changing.
Thank you for sharing this. I have so many questions. Do we have data on what it does to clinicians? There probably is. Now I'm starting to think, can you do Reiki for animals? But I do want to get to ask you a few questions, because now I think a lot of the clinicians who are out there listening are starting to get curious and saying, hey, maybe I can do this. And I think for the busy clinicians, just hearing that it takes 30 seconds, I think that is something attractive. So you mentioned before that there are levels of Reiki, and, so I want to ask you a few kind of questions about how you become a Reiki provider. Okay. So first of all, can anyone do this? Do we all have that ability to restructure or re-navigate the energy around us? Is that something innate, or is it something that we can all learn? And then can you tell us, how long is the training? Where can one get it? Is that expensive? What are those Reiki levels that you alluded to? So all this kind of in a nutshell, so our listeners can say, I'm going to become a Reiki provider.
Yeah. So to address those questions, so first, yes, anyone can learn Reiki. And honestly, as I've been in the world of Reiki and doing Reiki more, I tell people that a lot of times you're already doing Reiki. It's just, this is just giving you a kind of a name and a context and a container and techniques for it. Because, when we are sending someone compassion and love, or looking at someone with kind eyes, as they're tearful, that's Reiki. That's sending that loving kindness energy that's connecting to, something beyond us. And so really anyone can learn. And that's what I love about it. And one caveat I will say is that there is no regulation of Reiki or Reiki classes. So traditionally, there's 3 levels, and the third level sometimes is divided into 2 separate classes. So there's third level is a Reiki master, and then there's a Reiki master teacher. And what's unique about the Reiki system is that as you learn from your teacher, there's this process called an attunement. And I've heard it described, I like what one of my teachers described it as a spiritual blessing. So it's not like it gives you special magic powers or anything like that, but it's this special spiritual blessing that's passed down from Mikao Usui, the original founder of Reiki, to his students, and on and on and on. And so there's this lineage. And I use the analogy, it's like anyone can pick up a violin and start playing. But if you know how to tune it properly, and you know how to play it, and then you have a whole orchestra to play it, it's just so much more amplified and powerful. So that's the analogy I use. And there's many different types of Reiki too. So just like, there's, kind of an original religion, and then there's branches of it. So there's all different types of Reiki. Some include like Tibetan symbols, or there's even kind of like a Hawaiian Reiki blend. So there's a lot out there. And in terms of looking for a teacher, I usually just tell people, find someone that you resonate with, or you can ask around. And my teacher says, you don't find Reiki, Reiki finds you. And I've just found that to be the case. So it's a very different way of approaching things. It's just using your intuition, just, ask to be guided, ask the universe to guide you to the right Reiki teacher, the right person, if you are interested. And I'm always happy to, talk to anyone else about it. And then, one of my other plugs, quote unquote, for Reiki is that it's not that expensive. Back in the day when it was first brought to Hawaii, I think it was like $1,500, but, most workshops, or even just Reiki 1, can be $100, $150 for one day, a couple hours, and you could be Reiki attuned. I think one of the interesting things I struggled with was just how simple it was, and how quickly someone could just call themselves a Reiki master. You can find it online on like Udemy for, $24.99, get certified. So that's where, it's good to be discerning, because really anyone can take the training, which is one of the beautiful things about it. But also being aware of when someone is calling themselves a Reiki master, it just simply means they've had that certifications, and they could have just done a weekend workshop where someone taught all 3 levels, and then they can hang up a shingle and say they're a Reiki master. And so those are just some of the caveats, but I love it because you can do it anywhere, anytime, anybody. You don't even need to put your hands on someone. You can just, send it. So I boil it down to, if you take the mystical out of it, it's a mindfulness and meditation practice filled with compassion. as I've learned other practices like compassion practices or gratitude practices or mindfulness, it's a modality that encompasses mindfulness.
Amazing. Thank you. That was a very detailed answer. Although I got to say, Judith, you had me at no regulatory. It was already done. 30 seconds, no paperwork. And as a side effect, the clinician gets better.
I know. That's why I tell people, and honestly, your job is to do nothing. They teach you to kind of empty your mind and just
Right.
receive. And I'm like, when the heck do we get permission to do nothing? And that's the benefit, and that's where it emerges. So it blew my mind, and it still does. And I laugh at it because I'm like, oh, great, I get to do nothing now and enjoy it.
Hadar, when was the last time you did nothing?
I don't know, but something tells me it's about to happen right now.
Well, Judith, I think that leads us into the next question. Can you give us a sense of what is it to experience a Reiki session, even if it's just like a mini session here? What is it that one would go through, or maybe you can just take us through a very mini session to just help kind of give us an idea of what it's like.
Yeah. So for the person receiving, generally, you just have them in a comfortable position. Traditionally, if you're doing a full Reiki treatment, they're on a table, like a massage table with their clothes all on, facing upwards, or they can be seated in a chair. And sometimes they can have an intention of, I'd like this to help my left shoulder. But we always say in Reiki that it's not a directed treatment per se. It's really just supporting the body's own ability to heal. And we don't know, that could help a different area, that could help the left shoulder. We don't know, but just allow yourself to open to receive. And then as they're receiving Reiki, so everyone's different. So for the most very sensitive, intuitive person, I've heard people definitely experience warmth as they feel it, or tingling. Those are very common. I've had people where they actually start to, if they're kind of more of the clairvoyance, they have the gift of vision, they might start seeing colors, they might have memories, emotions. It's great for working with emotions. And I always tell people when they're receiving a Reiki session that emotions may come up, and that's actually a very healthy thing. It's helping your body release. And so tears are not uncommon. I, tell people to have a tissue box, nearby, and that it's a really kind of supportive and to allow these emotions to bubble up. But really, a lot of people just fall asleep. It's just very, I think, calming. I'd say that's the number one description I have people say. And as I've taught Reiki and heard feedback from my students that have done Reiki, they're like, oh yeah, my dog fell asleep. That's really hyper. Or they do it on their kids, which I love hearing. So people have done it on their kids. She's a physician. I forget what she does, but she says her 4-year-old asks for wakey. And he'll be like at night, wakey, can I get wakey? And so she'll do wakey. So that's how it feels. Now on the practitioner side, that's also very variable. I now do start to feel some flow of energy. It's taken me a long time, a lot of practice. And I also do some qigong. And so those are, kind of, all the ways. I know some people, they actually get really warm. They have to take off layers of clothing when they're doing Reiki on someone. And it's definitely opened up my intuition. And so I've kind of learned to develop that. Like sometimes, I'll just get a sense of a phrase to say or to ask about something, or I visualize something and I share it with them. And then of course, I always just say, with everything, it's just, this is, just if anything doesn't resonate with you, just let it go. But if it feels like it resonates, you can let it in. So I always let the person know that they have full discernment and they have full capacity as they're receiving Reiki. And so that nothing can enter their system without their ultimate permission.
Okay. Well, I think what I'd like to do then is, Judith, if you can take us through a very quick 30-second kind of practice so we can feel what it is, and then we will part with that great energy. How about that?
Perfect. Okay. So there's a hand position called gaosho. And so it's just like prayer position, just palms, and you can just put it in front of your heart. And then you can go ahead and just bring your attention to the center of your palms and to your breath. And as you inhale in, you're going to imagine that your body fills with energy. It first starts at the tip of your fingers, it flows through your hands and then into your heart and out at your body. You'll inhale that in, filling with life force energy. And as you exhale, just imagine that it expands like a mist all around you, 360 degrees. And so you're inhaling in the energy flowing in through your hands, your arms, into your heart, and then exhale out through your body. And with this practice, we can imagine that this energy that goes out like a mist, it starts to expand and it spreads into the room, all around you. And then it can spread even further. It can cover your entire home or whatever place you're in. It can cover your entire town. It can cover the entire United States. And you're just being a conduit. You're just allowing it to flow into you and then out through all directions of your body. And then why don't we just take a moment and have it expand to cover the entire earth, and especially we're in a present moment where there's a lot of turmoil, Israel and Palestine. So let's go ahead and allow that energy and that compassion, wishing for peace and safety to all the people in the world. And we just get to be a conduit. We're just bringing that life force energy in and exhaling it out, and just imagining we're surrounding the entire planet with peace and compassion. And then we're going to bring the energy back in. We can put our hands on our heart. And we'll just take a moment and just imagine that the energy actually flows into us and then back out of our hands into our heart. And just really taking a moment of gratitude and appreciation for our heart, for the heart that is so compassionate, especially all of us physicians and nurses and nurse practitioners and PAs and estheticians and everyone who's helping people. This is a chance for our heart to receive as it gives out so much. And so just breathe that in, let your heart fill up with life force energy and gratitude. And we'll go ahead and take 3 more deep breaths, and then we'll come out of this trance.
Well, ladies and gentlemen, this is Judith Hong, and I feel so revitalized with great energy. And I would like to just end here and thank everyone for joining us, and especially Judith Hong for taking us through all this knowledge and really a cool experience. And go out there and explore all the practices that can make you and your patients better. Thank you, Judith.
Thanks for having me.
Folks, I hope you enjoyed this episode. And if you enjoy learning about integrative dermatology, we want to fill you in on a little secret. It does not have to stop here.
That's correct. You should become a premium member.
A premium member? Hey, Raja, tell us, what does that mean?
Well, we have a private community at Learn Skin for practitioners who want to learn more and connect even more closely with like-minded colleagues.
That's correct. This is something that we have developed over the years based on what we wished we learned in training. Not only do you get a discount to the annual Integrative Dermatology Symposium, but you also get exclusive access to content that is not available to the public and a private online community to network and engage with.
So don't wait. Together, we can advance patient care. Join us as a premium member today, and let's get integrative.